Pelvic floor muscle dysfunction is the subject of this video. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy in Irvine. Stay tuned. Alright, so it's getting really confusing for a lot of people because we talk about pelvic floor muscle and then we talk about pelvic floor dysfunction, and then there is this hybrid pelvic floor muscle dysfunction, which is really a term to use. But first of all, I want to make sure you clarify and you're clear about pelvic floor muscle being a part of pelvic floor dysfunction package. I've done a whole video on what that package entails. We're going to make sure we put at the end of this video. But when we talk about pelvic floor muscle dysfunction, we're referring to the muscles of your pelvic floor which line the inside of your pelvis. And they're highly aggravated with two functions: walking, naturally that is, and the other one is an actual sexual intercourse. Those muscles get really worked during those two activities. So not that I'm subscribing to you to go ahead and just get busy every second. That's just not practical. But we're talking about the role of activity on the pelvic floor muscle. So the dysfunction happens as a result of lack of activity. What is that? You sitting behind your computer and typing away. You're sitting on the couch and watching Netflix. I do that, but I also do the other stuff. So we're off balance. So the actual pelvic floor muscle dysfunction happens as a result of weakness of the pelvic floor muscles. Now, another thing I want to clarify is that the weakness comes because of two things. One, the muscle or muscle groups are overworked, therefore they get weak, or they are underworked, so they never get to play. So that's the two versions of how you get the weakness. So when they're overactive and spastic, we call that non-relaxing pelvic floor muscle. When they're not being used properly, we call that pelvic floor muscle weakness. There are different presentations of them. For example, an urge incontinence is a version, or an overactive incontinence is a version of pelvic floor muscle going into spasm and not letting go, or the bladder doing that. All the other versions of incontinence are the weak part. So then the treatment changes based on the presentation of the pelvic floor muscle status. So in order to strengthen the weakness, as long as it is not as a result of non-relaxation, we go with kegel exercise as a quick way to get to it. The only problem is you can't do it at the level it needs to be. So in our office, we made that realization very quickly, and we ended up with a machine called emsella that does 400 kegels a minute. That's not for everyone, but that's how we jumpstart, and then we move on to all the other things that need to go in the treatment. At any rate, I hope that this clarified some of the ambiguity in the terminology. And if you like what you watch, please subscribe to the channel and make sure you contact me with any of your questions. Take care.